See this right here? That's a major problem. The medical giant Goliath medical facility. What we have here is Sanford Health. They've expanded into many states. They're just a huge giant, headed up by T. Denny Sanford. Even more money is being thrown into it by investors that are just getting filthy rich off of it. The investors actually have as much, if not more, money in it than T. Denny Sanford does. You know, if he would have taken that money, put it into the natural, homeopathic, naturopathic, any type of naturopathic means to healthcare, just think what he could have done with that money. I mean, he could have done so much more good. If it's getting better, why is it getting bigger? If people are getting healthy, if people are getting better as far as people aren't as sick as they used to be, and the whole system is better and works better, why is it getting so much bigger? Why does it need to get so much bigger? You know, you have to go back to the early days of healthcare, at the end of 1800, early 1900. You need to look at Pasteur and Bechamp. The controversy. Most people have never heard of Bechamp, Antoine Bechamp. Pronounced Bechamp, sometimes been on. But anyway, you need to focus on that soil and the seed theory and find out what the differences were between Pasteur's theory and Bechamp's theory. And Pasteur's was the only means by which kill all the germs and kill all the disease, and kill the cancer, kill everything. His is the only thing that would support pharmaceutical drugs. Bechamp's information was all natural. It never would have made any large amount of money. I mean, quite obviously you can make money with the naturopathic side, but you can't make near as much money as you can patenting drugs. And of course, you know, in late 1800, early 1900, the Rockefellers and the Rockefeller family were already going after this. And by 1930, they had all of the medical schools under the all drugs approach, all pharmaceutical drugs approach, and everything was naturopath related. Natural related was basically run off. I mean, they were branded as junk science and charlatans and all this. You know, well, now we can see who the real charlatans are. Well, it isn't that it's all bad. It's not all bad, because the ERs do a great job putting people together after a car accident. They do a great job with that. You know, if you're having a heart attack, they can save your life. If you're having a stroke, they can prevent that from getting worse. But it's overall that, in the bigger picture, that the problem is. That's where it is, that's what people don't see. In the year 2000, Barbara Starfield, there was a study published in the American Medical Association Journal where they looked at all of the figures, drug reactions, everything from top to bottom, and it was determined that in the big picture that modern medicine was the third leading cause of death over heart disease and cancer. And they did another look at it. There was 3, 4, 5 doctors, I guess it was, that looked at it again, and they took additional data, and they determined that modern medicine was the leading cause of death. Well, that's a problem. Modern medicine is the leading cause of death by the numbers, and the number, if you put all the figures into it, all the data, there's just under 1 million people a year that are dying because of one form or another of medical care. That's not a good thing. Vaccines, look at that. I mean, you have to look at this thing from a perspective of the soil and the seed. If you put a bunch of seeds that you want to grow something in toxic soil that's non-fertile, what are you going to get? You're going to get a lot of weeds and very little good plants. If you take and you got fertile soil, it's non-toxic, what's going to happen then? Well, you can control the weeds, and your good plants are going to survive, and they're going to thrive. Well, the same thing is true with the human body. How difficult is this? You cannot inject 49 doses of 14 vaccines before the age of 6, 69 doses of 16 vaccines by the age of 18, and expect that to have a good outcome health-wise. You know, vaccine injury. Just because you have a vaccine injury or you're harmed by vaccines doesn't mean you're going to have autism. You know, you could have severe seizure disorders. You could have neurological problems. You look at the Gardasil girls that are harmed by Gardasil. They don't have autism. I mean, this whole thing with vaccine injury is so much more bigger than what they're giving it credit for, or showing us on the medical side. Gardasil as just one of the worst. It's probably the best example there is of the inability of the FDA, in the unwillingness of the FDA to produce and assure safe vaccines. This vaccine, Gardasil, should have been taken off the market. Cervarix, same thing. They both should have been taken off the market. What are they doing? The FDA is just sweeping it under the rug. Vaccine contamination. I mean, I could go on with this forever. Gardasil has been found to have the recombinant HPV DNA found in the vaccine, firmly attached to the aluminum adjuvant. And even that isn't enough to get that vaccine pulled. Gardasil deaths and unrecovered outcomes from this vaccine are in the hundreds, if not thousands of girls. I got another plane flying, unfortunately. But anyway, backfacts.info is my site. Go there and learn the truth. I've tried to put together a package there that will show you step by step what you need to know. In fact, I wish I would have had that site when I first started looking at this, and I've been looking at it and researching for about 3 to 4 years. So, airport outside of town here. I'm going to cut this video off, and thank you very much. Backfacts.info. Backfacts.info is the site. Thank you very much.